Hey, what's going on, everybody? Welcome back. This is the Knee Pain Magician. Hope you're feeling and moving well. This week, we're going to be working specifically on your hips. So what I noticed in working with a lot of people who are over the age of 50 is that they haven't necessarily been sedentary, but that a lot of their joints are stiff and kind of stuck because they haven't been used to moving those areas specifically and as kind of independent part of their body. So one of the main problems with Western medicine when it comes to treating knee pain is that they focus too much on where it hurts. This is kind of like a mechanical understanding of knee pain, right? If you have knee pain, it must be because you have arthritis. If you have knee pain, it must be because you're bone on bone. So in order to fix that, we're going to be doing building strength around the muscles of your knee. We're going to give you steroid injections or PRP. Whatever it is, it's focusing on where you have the problem. However, pain works a lot differently than what most doctors inform us and kind of our culture as a whole knows. In reality, pain always comes from your brain, not your knee. And you can even have pain and not have a physical problem. I know that sounds hard to believe, but most people who are over the age of 50 and 60, etc., have degeneration within their joints. Hips, knees, spine, etc. A large portion of those people have no pain, no symptoms whatsoever. So that kind of goes to show that, you can have problems with your joints, but not have pain and not have movement difficulty. So I want you to kind of think about that for a moment as we go through today's lesson. So the reality of knee pain is it's always a protective response from your brain when it feels a little bit disconnected or not comfortable with moving your body. So pain is a great way that your brain can communicate with you that it doesn't feel ready to do whatever movement, right? Sending out pain, sending out stiffness, it's going to lock you up in place, not putting you in a position where you may potentially injure yourself. And that's essentially what pain is. It's a worry signal. And one of the best ways to let your brain know that everything's okay with your knee and with the rest of the body, and that you can move comfortably without pain and stiffness, is just to improve the way you move your body. Like I was saying earlier, most people, especially as you get older in age, tend to have stiff joints. Now, I know there's a lot of people are going to say, well, I do yoga and I mobilize and I do this and that and I don't have stiff joints. Well, movement is great, but you also need to have really specific mobilization within your key joints. So in a lot of my previous videos, we've discussed the importance of mobilizing all of the important joints in your ankle, in your hip. And today I want to focus specifically on your hips. Because if you think about a structure, you have your ground floor, right? That's your foot and ankle. Then you've got the problem area, which is your knee. But obviously then above your knee, you have your hip. So many times knee issues come from the foot and ankle, but they can also come from a stiff hip. So what I've seen over the years in working with older people, 50 and up, excuse me, I won't say older people, but people 50 and up, is that when you improve the mobility within the pelvis and the hips, both sides, not necessarily where you're having pain, but oftentimes that gets your body flowing and moving better, and your knee pain reduces and you feel better moving as a result. Okay, so before we go over 3 of my favorite hip mobility exercises, what I need you to do is assess and check in with your knee and how your body is currently feeling. So if you've seen my channel before, you know what I'm talking about. If you're new, basically what this is we want to have a scientific approach. So although everyone's nervous system is essentially designed the same, we all have different life experiences and contributors to your specific knee pain. So what may improve Rebecca's knee pain may be a little bit different than what improves your knee pain. But the only way you know is if you go through an exercise and see how you feel after in comparison to how you felt before the exercise, right? Some exercises will make you worse. If you've ever gone to physical therapy or tried to do some at-home stretching or strengthening exercises, maybe you've experienced that what you've been told to do or what you saw and were trying to replicate on your own actually didn't feel good. It made you worse. So we obviously don't want to do that, right? This channel is dedicated to making you feel and move better. So in order to know what works for you is that you have to test after each exercise. So what are some of the ways to test? Well, the number one way I like to try to, the number one idea I like to try to convey to people is the importance of walking, right? So you could just go for a walk. Maybe you're walking down your hallway, or you're taking, 10 paces up and down your living room floor. It really doesn't matter. But as you're walking, I want you to pay attention to your pain scale in your knee, right? If you have chronic right knee pain on a scale of 1 to 10, 10 being, oh my God, this is horrible, 1 being, hey, you feel amazing. So where are you right now in the moment? And again, it's specific to you, right? Everyone has their own pain scale. Don't worry about them. Just worry about how your body is communicating with you. So where are you on that pain scale? As you're walking, do you notice that you have a limp? Is your hip really tight? Are you kind of walking off balance? Just kind of pay attention to the overall quality of movement. After you've gone for a walk, paid attention to what your pain scale is, maybe take a mental note of that or jot it down. I want you to do some range of motion assessments. So you can touch your toes. You can do a few squats. Again, this all depends on what's going on with your body specifically. Maybe a squat's not appropriate. That's totally fine. An assessment is based off of your specific needs, right? You can see me from the side, how I'm doing a squat. Bending my knees, bending my hips. Again, a squat for this is not an exercise to build strength. It's more of an assessment to see, can I squat or bend down? And what's kind of my level of pain and restriction as I'm doing so. Okay, so now that you've gone through your assessments, I want you to take a mental or a physical note of that, store that to the side, and now we're going to go through our exercises. Okay, so this first exercise is called an hourglass. So I want you to think of an hourglass. Hopefully this movement here kind of gets you thinking about what an hourglass looks like and what that movement entails, and it isn't too ridiculously confusing. But nonetheless, first thing I want you to do is I want you to take your hands and I want you to rub your pelvis. I want you to rub around your hips. You can rub around your tailbone, top of your glutes. This is called skin stimulation. And what it's doing is it's helping connect your brain to the area of your body that we're trying to move. So all around this area. Okay, now that you've kind of warmed that area up per se, you're going to go nice and wide, right? Notice how my feet are facing forward. My feet are wider than my hips are. I'm going to put my hands on my hips. I want you to think of your belt line, right? So hands on the belt line, and you're going to rotate your hips in a circular direction. So I want you to pay attention that as my hips are moving, my shoulders are going in the opposite direction in kind of the equal range of motion. So as my hips go to the right, my shoulders go to the left about the same degree. As my hips go back, my shoulders begin to come forward. As my hips go to the left, my shoulders rotate to the right, and so forth. So think of an hourglass. This is the movement that we're trying to get you to do. So the center of the movement is coming from my pelvis, or my hips. You see me from the side, nice and wide, rotating my hips. As I'm doing this, I notice a lot of tension inside of my hips, the very top, kind of by my groin. So, and I know historically I have a lot of tight hips, basically. Internal rotation of my hips is tough. So I want you to try to do 10 circles clockwise. I want you to try to do 10 circles counterclockwise. The number one way that people go wrong in this exercise is that they move their upper body. So my torso is moving a lot, but my hips aren't moving much, right? So I want you to think, okay, can I begin to move my hips? If the hourglass idea doesn't quite connect with you, I want you to think of a hula hoop. Maybe you were a hula hoop person when you were younger. Think of what that movement entails, and I want you to try to exaggerate that. And if you feel it on the inner hips, that's fine. We're trying to get healthy movement. So this is a basic movement pattern. Big hip circles. You should be able to keep your feet facing forward. Want you to think of moving your hips independently of the shoulders. So we're not doing kind of the same movement, right? The shoulders are doing the opposite movement of the hips. So try not to go too fast. Try to get a good movement down. Go 10 circles each direction. And shake it off when you need to. One thing that's always very important to keep in mind, no matter if you're working with me or anybody else in the whole world, even by yourself, you never go into pain. So if you're trying to do something and it hurts, it's making your pain worse, that's a signal to you that you need to stop and change what you're doing so that you can try to do the rep or the movement without any pain. So I also try to separate like pain from maybe stiffness or a little bit of discomfort. It's kind of like two different things. Oftentimes, I'll try to coach a client through these movement practices that say, ooh, that's stiff, or I haven't used that for a while, or man, that feels like that needs a deep stretch. So that's a little bit different than, oh, that's making my knee worse, the pain sensation worse. So if this particular hourglass hip exercise makes your knee pain worse, stop. You could try to limit your range of motion. Instead of having a really wide spread with your feet, come a little narrower. Instead of going really wide, you could kind of reduce your range of motion, change your speed, see if that helps you. If not, you could try the next exercise. And that's what we'll work on now. After, you're going to go and reassess. So after you've done your hourglass hip circles, clockwise, counterclockwise, 10 reps more or less each direction, I want you to go for another walk. Pay attention to that pain scale on your knee. Where are you now on that 1 to 10 basis? How is the quality of your gait? Can you squat down a little bit deeper with less pain, less restriction? Those are the things we're looking for. Okay, so this next exercise is called an open chain hip circle. So this could be really good. It kind of depends on your specific knee pain. Oftentimes, someone who's got really bad knee pain, it's hard to stand up and stabilize on one leg. So it kind of depends on your circumstance. This can be a great exercise, but again, test it and just see what's possible for you. So what we're going to do is rotate essentially one of your legs at a time to move the hip joint. So I want you to think of your hip capsule, then I want you to think of your leg or your femur. And what you're going to be doing is kind of doing this rotational movement with your leg inside that hip joint. So it sounds very basic, but it can be a really high payoff exercise depending on your knee pain. So if you see me, if you're at home, you could use a chair for a little bit of stability. You could use your wall. So I'm going to stand on my left leg, and with my right leg, what I'm going to do is draw a big circle. So my right leg goes forward, I go out to the side, I go behind me, and then I come in and I brush against the inside thigh. I just kind of do this circular motion. So my left leg is burning a little bit because muscles have to stabilize and work and support. But notice I am kind of doing like a symmetrical, somewhat semi-symmetrical circle, right? Going equally forward, out to the side, and out behind me. My circle isn't just forward, it's not just to the side, and it's not just back, but I'm trying to cover that whole kind of territory, so to speak. So I want you to try to do 10 circles, one direction. Then if you see me from the side or from the front, it would look like 10 circles the opposite direction. So clockwise, counterclockwise, clockwise and counterclockwise. Try to get 10 circles each direction, each leg. Remember to breathe. If you feel fatigued, if this is causing more discomfort in your knee, take a break. Rub that area. Do another one of the exercises from my channel that you've learned has been really beneficial. And think about the quality of your movement if you're doing this. You're nice and smooth. You're not clumsy. You're symmetrical. So very basic, right? 10 circles each direction. So those are called open chain hip circles. So open chain just means that part of your body is disconnected from the ground or from anything else, right? It's open, it's kind of moving, floating in the air. And it's really good because it's working that hip. So again, the reason why we want to have really good movement within the hip and pelvis is because that is the top joint of your thigh bone that connects into the knee, right? So you've got your thigh, your femur. Top of that leg is your hip. The bottom of that is your knee. So oftentimes you can have issues in the lower part by the knee because you have stiffness within the hip joint. So we want to have a really good mobility within both. But again, sometimes it's best not to focus on where it hurts, and it's better to focus on other areas that may be kind of the underlying contributing area first before you go to the area that actually is hurting and giving you trouble. So again, open chain hip circles, try to do 10 reps clockwise, counterclockwise, rub the knees, rub the hips, and again, kind of modify it if you need to, depending on how your body. All right, so this is the last exercise we're going to be working on this week. It's called pelvic circles. So we're going to be isolating your pelvis, not kind of that whole midsection or this region of your body, but specifically the pelvis. So one thing I've really noticed working with people 50 and up is that they struggle to have isolation and motor control for that particular area. So this could be key if you also have lower back pain. But remember, the better your joints move, the better your body is allowed to move as it was designed to. So also when you're mobilizing joints, you're working something called proprioceptors. Proprioceptors are little receptors that live within the tissue and joint capsule. And when you work that area, they get stimulated. That sends signals up your peripheral nervous system to your brain, allowing your brain to feel, aha, there's that area of my body. There's my ankle. There's my knee. There's my hip. I have control over that area. It's not as foreign, right? Your brain knows you have these areas of your body, obviously, right? But if you don't isolate and focus on moving them on a, somewhat regular basis, that kind of connection or map can get a little bit blurry. Blurry maps when it comes to movement in your body lead to pain, right? Your brain needs to have control, it needs to have awareness, it needs to have full function of these important areas of your body. That's why we're specifically working on mobilizing your hip today. So what I want you to do is you're going to be standing up nice and tall. You're going to have a slight bend in your knees. Your feet are going to be right underneath your pelvis. And what I want you to do is think of your belt line and your pelvis. And what you're going to be doing is gently rotating your pelvis backwards and forwards. Backwards and forwards. If you see me from here, this is called an posterior pelvic tilt when I'm tucking my butt, and an anterior pelvic tilt when I'm arching my back. So all you're doing is nice and relaxed. You've got good posture with your spine, rolling your pelvis forward and backwards. Posterior pelvic tilt, anterior pelvic tilt, rolling backwards and forwards. A lot of times people are super stiff and they just quite can't get this movement down. So notice my knees aren't moving too much, right? You see a little bit of movement in my thighs. There's always a little bit of bending in my knees. My upper body is stable, but I'm just rolling my pelvis back and forth. Super simple, right? Tilting the pelvis. Okay, now the second movement is a little bit more challenging. You're going to put hands on your hips. What I want you to do is bend your right knee, and that's going to drive the left side of your pelvis up. As you bend your right knee, the right hip drops, but the left hip raises. And then you're going to do the opposite. You bend the left knee, drops the left hip, raises the right. And then you're just gonna alternate. Bend the right knee, bend the left knee. Bend the right knee, bend the left knee. Notice my shoulders are flat, right? They're not going like this, topsy-turvy. They're staying pretty consistent while I am bending my knees and tilting my pelvis side to side. As I bend my right knee, I'm really focusing on driving the left side of my hip up. As I bend my left knee, I'm focusing on driving the right side of my hip up. Right? That's what I want you to work on. I bet you're going to be at home and you're like, boy, I just can't do this movement. That's okay. Rub this area of your body. Help get your brain a little bit more connected to it. Just be calm. Have a little bit of patience. Just focus on getting this movement down. Okay, so we've done forward and backwards pelvic tilts. We've done lateral hip hiking, and now we're going to try to connect those 4 points. Forward, side, backwards, other side. So if you want to put your favorite salsa music on, you're more than welcome to. And so basically this is what it looks like, right? I'm going to draw a small circle with my pelvis. Forward, side, back, other side. Forward, side, back, other side. So I'm rolling my hips, circular direction, clockwise, and counterclockwise. There's not any tension in the rest of my body. I can notice that as I'm going towards the right, I have a little bit like less control or range of motion than as I go towards the left. And that's just something that I'm exploring. And then I'll show you from the side just so you can see. So I'm here, again, hands on my hips, shoulders are nice and loose. Now I'm going to go counterclockwise. Forward, to the side, back, opposite. Just rolling around. One direction and then the other direction. Okay, so those are pelvic circles. Probably out of all the exercises here, those are the most difficult. That's why I did it at the end. We started with these big hourglass hip circles, and then we worked on isolating the hip by just moving your thigh and your leg. Then we kind of concluded with a little bit more, I don't know, nuanced or complex exercise, but it just requires more body ownership and isolation of the hips of the pelvis. So all of these exercises are really important to do. Some are going to give you a higher payoff than others. That's why at the end of each exercise, I want you to reassess. Go for another walk, pay attention to your pain scale, try a few squats, see which exercise gives you the best reward. Again, of course, you don't want to go into pain. So if you're doing one of these movements and your knee feels worse, I want you to see what you can change to try to do the exercise in a pain-free way. Maybe you have to limit your range of motion. Maybe instead of going fast, you have to go a little bit slow. Or perhaps you have to skip the exercise entirely, which is not a problem. You just think of, okay, why am I getting pain, or where am I getting pain in that movement? Put that to the side for a second and then just work on one of these other ones. Again, big picture. Knee pain doesn't necessarily mean that something's wrong with your knee. The majority of times, it's just because there's a disconnect between your brain and your knee and the rest of your body. Again, pain is only a warning signal from your brain that it doesn't quite feel confident in moving your body. So if you poked around my channel, you notice that we work on lots of different things. We work on breathing. We work on improving your visual skills. We work on balance. We work on the sensation of the tissue around your skin. And we also work a lot on joint mobility. Not just mobility within your nerves, but mobility within the joints themselves. Ankles, knees, hips, spine, etc., even elbows. All of these joints are connected. They're all important, not just to your knee, but for the rest of your body. And specifically, the hip is the big joint right above your knee. So if you have a problem with your hip, what are the chances that you're going to have a problem with your knee? Pretty high, right? So these are just a couple of exercises that are likely going to help you feel and move better in your pursuit to reduce your knee pain, get back out, playing with your grandkids, playing pickleball, walking around the neighborhood with your girlfriends. Hopefully you found this video helpful. If so, I always appreciate your support. If you could click the like button and subscribe to my channel, that's amazing. In addition to that, if you're someone who's really been struggling with chronic pain and you're looking for a long-term solution that does not require injections or potential surgery down the road, I've got a unique opportunity for you next week. I'm going to be running a 5-day live challenge. We're going to be working on a lot of the different things that you saw today. We're going to be going through big picture concepts of what knee pain really is and how it's not actually related to arthritis and bone-on-bone degeneration like you may have been told. So by the end of next week, you're going to learn lots of different exercises. We're going to be working on that together. I'm going to be coaching you through these things, helping you get a better understanding of how your body works, what's contributing to your pain, and what's going to give you a long-term solution. So if you're interested in that, you can work with me at a very low cost next week. I'll provide the link at the homepage and at the bottom of this video. So that's it for me. Thanks a lot, and talk to you soon. Bye-bye.